Thank you very much. Hopefully everyone can online can hear now. So I think we all know in this room that device and time-based measure and device ownership, they really tell us very little about what young people do online. And even the American Academy of Pediatrics, which was one of the very strong supporters of screen time-based measures for a very long time, in their most recent guidelines, they are talking about digital ecosystem. And this is where, as researchers, we are faced this way. So we are faced with this conundrum. So how we now measure what young people do online, and not just what they do, but actually what sort of psychological reactions they experience, what kind of thoughts about themselves they have, what kind of feelings. And this is really important because the way we measure things has also impact on how we design the interventions to support young people's mental health in this digital world. And currently the discussions about bans, restricting access, they very much are built on this premise that less access or reduced access is to be better for young people's mental health. So as a group, when we started thinking about how we can measure things better, we thought that actually what we first have to do, we need to take a step back. Because much of the research that we've had in this field was very much data-driven. People were giving questionnaires, young people were giving questionnaires, their parents were giving questionnaires, and researchers analyzed the associations. But this actually tells us very little. To design good measures, we need to start with good theory. And this is what we did in our Diora team. So the model that we have designed, the Diora model, is very much based on the existing developmental psychopathology framework. And it is based on these several premises, and I'm going to walk you through this model. So first of all, we assume that digital activity, and this is with the example of how digital activity might work to affect adolescent depression. Both digital activity and first of all, they change over time, so they are not static. So we take this developmental lens to look at things over time. And the key aspect of the Diora model, or the key mechanism, are psychological reactions. So as I mentioned already, how does being online make young people think and feel about themselves? We also recognize that these pathways might work in both ways. So it is not just one direction from digital activity to depressed mood through these psychological reactions, but actually these paths also operate in the opposite direction. So depressed mode might actually drive what young people do online. And importantly, it helps us to think about intervention targets. So we can intervene not just at the level of digital activity, but also at the level of thoughts and feelings. And young people, so these pathways can be, depending on young people's agency, awareness, recognition of problems, the risk may be mitigated. So this is the one pathway, but the risk can also be exacerbated. So we have these two pathways. And of course, we also recognize that digital activity does not occur in a vacuum, that there is a whole host of non-digital factors that might impact young people's both their depressed mood, but also digital activity. We're talking about biological factors, social factors, and other. So now we have this model. The next step in our work was to develop a new measure of digital activity. And we spoke to many people, many young people. So our target age range was between 13 to 17. We worked with a youth panel, but also Maria and Kaya and Sonia did brilliant workshops in primary schools. When we were trying to gauge what sorts of activities young people do in experts, we did literature review. And based on this work, we developed two questionnaire-based measures. So our measures are designed to be given to lots lots of young people measure things at scale. The first questionnaire is called the Digital Activity Feelings Inventory, or DAFI for short. And from a large pool of items that we had, that we gathered from our research with young people and literature searches, we group these activities in 5 broad categories. A couple, such as leisure activities and social engagement, might be potentially more neutral or maybe even positive to mental health, but 3 remaining groups of activities such as risky content. So risky content might include things like seeing maybe violence, maybe something related to sexual activity, related to self-harm. So activity and content that is risky to mental health. Risky interactions covers things such as maybe exposure to cyberbullying or racial related hate, but also meeting people who are strangers and meeting them in person. So meeting people online in person. And social comparisons, so very much items that really involve social evaluations, how young people compare their looks or their popularity to others when they are online. But you also see that we not only measure these activities, but also the psychological reactions that people experience as a result of these exposures and interactions. And we broadly group them into 3 categories. So activities where young people feel negatively about themselves. They feel hated, they feel rejected, they feel unsafe. The second category was more general stress reactions, so feeling stressed, feeling overwhelmed, overstimulated. And the final category is positive reactions, so feeling loved, feeling safe, feeling supported, and so on. This one, I don't have a huge amount of time to talk about the data, but what's really encouraging that most of the activities and most of the reactions young people, or the most frequently experience, are positive activities and also positive reactions. But there is also evidence of engagement and research to this. The second questionnaire which we developed, and this is very much also to look at people's awareness, is digital insight and agency scale. And it measures 3 aspects of digital activity. So first of all, daily impact. So what is the impact of what young people do online on typical daily activities? Sleep, their relationships with others, maybe whether they forget to eat. Does it have an impact on their schoolwork, but also on the activity? Does it reduce the amount of time, or does it reduce in the way we also measure with this questionnaire to what extent young people are aware of the impact that digital activity has on their mental health. So does it affect them? Do they think it affects their mental health in a positive way, or do they think it affects their mental health in a negative way? And also, are they worried about this? And again, what we found that about 90% of people think it has a positive impact, but about 80% also negative impact. So they are not necessarily polar sort of sides. They have both kinds of recognitions. And finally, we ask young people what they are already doing to keep themselves safe online when it comes to their mental health. And young people are already doing a lot, and it actually echoes what we heard in earlier sessions, and especially what young people are actually very active. They have good awareness. Also, they already do a lot to support positive development in the digital world. So young people are enhancing their positive engagement. So it might be looking for more positive content. Coping is the factor that concerns more active steps, so maybe blocking accounts, reporting accounts, maybe speaking to a trusted adult. And reducing engagement, it's either switching off, having notifications of what we find. This is the least frequently used reaction that young people take. I am very briefly going to talk you through our emerging findings. So these findings are from a longitudinal survey with young people. So they were 13 to 14 when they were recruited into the study. So year 9 and secondary school, recruited from secondary schools in England. I think we also had maybe a few participants from Scotland. And we followed these young people over the course of 16 months. They completed questionnaire baseline, 8 months later, and then 6 months later. Most of the data collection happened in schools, but the middle survey was done in children's homes in their own time. And we asked them to complete our new questionnaires, and we asked them to complete 2 years of mental health, specifically measured symptoms of depression. And we looked at 2 things. In our analysis, we looked at, just going to look at the activities today, because we're still analyzing the data. But we looked at what are the relationships between young people, but also what happens when we look at same group of people over time. I'll try to explain it maybe when I talk about findings. So when we look at between young people, so we look at sort of stable trait-like differences between people. These sorts of analysis do not allow us to infer causality. Okay, we just look at differences between people and the associations that we can record over time. So what we found that anxiety and depressive symptoms were higher in young people who also compared themselves to others online. They saw more risky or upsetting content, so our risky interactions factor, our risky content factor, and had risky or difficult online interactions. As I said, it doesn't tell us much about causality. What it tells us is that just these activities and mental health are related. And they are related quite strongly. So we're talking about effect sizes, standardized beta coefficients of between 58 to 0.7, so quite strong relationships. And as I said, we can't be able. What we also did, we looked at within the same person. If a young person is doing a certain activity more at one time point, does it affect what happens at the next time point? And we found here that young people who at the one time point were comparing themselves more to others or had more risky interactions, then they were also more likely to experience even increases in depression. But the effect sizes for these relationships were much smaller than those of in-person differences. You might, if you remember the figure from my previous slide, you might be thinking, well, what about these reciprocal pathways? Is there any evidence that mental health impacts subsequent digital activity? At least in this group of young people, we didn't find any evidence. Doesn't mean it doesn't exist, but not in this particular data set. We are seeing ups from certain digital activities to mental health. We haven't finished analyzing the reactions. We haven't finished analyzing areas. So basically, watch out for the findings. And just to highlight that other types of activities such as leisure and our general social engagement were not linked to mental health. Okay, so now moving on to ORCID. So again, another brilliant team of people. And ORCID is very much motivated by, so our previous research was about adolescents, but we very quickly realized that by the time children reach the age of 13, 14, they already have a lot of agency in using digital devices, they're already experiencing mental health difficulties, and there are other very important developmental periods that we should find more about. And this period concerns the age just before transition to secondary school, so ages between 8 to 10, when young children are becoming more socially independent, or independent when it comes to using their devices, and are preparing for this very important change in their lives. So the audit is very much going to build on the Diora project to measure how online experiences affect mental health in late childhood. And this is because I think, again, it was a point that was made earlier today, that we have quite a lot of information about adolescents, maybe young adults, when it comes to the digital space, but we have a huge evidence gap when it comes to I'm just going to skip through this in the interest of time, but very much the premise of this project, the motivation for it is that we need good measures again to capture children's online experiences, but also their digital agency. So very quickly, what we're going to do, we're going to work with children, parents and teachers to first of all get a really good understanding of their online experiences, but also their agency and their awareness. Want to explore the influences of peers, influences of the family environment, but also the broader social context. And we're going to use our measures developed in the Diora project to co-adapt, work together with children, and this is really important. We heard earlier in the sessions that children's voices are very much missing from a lot of aspects of what's happening in the digital sphere, but I think we pride ourselves in, especially in our research, on making sure that children do have a voice and their voice really matters. So they'll be really active participants in this research, not just by filling questionnaires, answering our questions, but actually helping us to make these measures useful and adapted to them. We're also planning to co-design again with parents corresponding tools for adults. And the plan is to conduct a very comprehensive psychometric evaluation, because we want these tools to be available to the research community, we want these tools to be used and have value to others. But also something that I am very much looking forward to is trying to use also the time we have in these projects to start thinking about developing digital well-being intervention for families. And this is very much to build on the existing awareness and skills and strengthen children's resilience. Again, this will be something that we hope to do in collaboration with parents and young people. And just if you'd like to find out a little bit more about the Diora project, there is a QR code, but I have also linked. We started turning our Diora messages in bite-sized tips for young people. Again, working with young people, it's been an extremely fun project. Here and Maria are here in the audience. We work together with the youth panel and the very talented animators to start turning some of our findings into fun animations that hopefully help young people to maintain their digital. That's all for me. Thank you very much. Maximum, so I can't. You see where the microphone might help you online. Okay. So a little bit out there from our panel. So we're going to hear from Damon Diono, who is a managing director and owner of Revealing Reality.
Hi everyone, yeah, I'm Damon. I run a 25 person social research agency. We do a lot of work in children's use technology, actually adult use technology as well. We work across the social research spectrum, but we do have a real speciality in what young people do online, and I think that's a gap. Obviously, we've been talking about screen time there. We do have some data already on what children do, when they're doing it, how much time they're spending on their devices, but the granularity around that is quite limited. You can see here you can get some times what they've done on different apps, but we don't know that much about what they're doing. And I also think generally this whole discussion area is slightly devoid of information understanding about what people actually do on their devices and inside these apps, how they use social media, what they consume, what they're exposed to, what they see. There's quite a lot of mythology actually out there. I think when you do show people, if you actually collect people's content, you collect what people are doing, and you show people, they're usually quite surprised. So I just want to start talking about TikTok. Obviously, predominantly short form video. Real usage is quite similar. So it is people scrolling through short term video. Got infinite scroll features there. Come on to that a bit later on. Shopping platform. A lot of the things we see young people buying now are through TikTok Shop. Obviously directly from what they see online, how they're influenced. TikTok Listing has also recently introduced messaging in the streets, which is its way of basically trying to get into the Snapchat space, I guess, and the messaging space as well. Snapchat, obviously, it's young people's go-to kind of messaging platform. When they get a bit older, they might change out of it, but still they seem to stay with Snapchat. So when you look at teenagers' online time, it's TikTok for consumption, bit of Instagram maybe, Snapchat for messaging. That's generally how the profile breaks down. Not everyone's the same. So here we've got messaging, we can have calls. Got an amazing thing at the moment where lots of young people are calling people overnight, leaving the call on, both going to sleep in separate locations. That's happening quite a lot. We're seeing that now. Streets, so gamification, that's actually as well. Stat maps and location tracking, quick ads, so you can easily meet new people. It's not actually on here, but stories. So some people use TikTok stories, and in some demographics and some audiences, they use actually more than TikTok, but that's quite niche. Roblox, a lot of you will know about Roblox. It's for younger children, so we tend to see that in kind of 8 to 13. It still carries on a bit, but that's where a lot of young people are doing their socialization, meeting people, also just playing games. Again, got currently game currency and some shopping aspects, although mainly around kind of digital cosmetics, I suppose. Different forms of text chat. So all of this is to say, when you talk about screen time, and you try and say, well, is screen time good for children? Does it make them happy? Does it affect their mental health? That depends what they're doing. They might be talking to their friend. They might be consuming endless hours of very short form brain rot content. So we want to go beyond that. And I'm going to say this because it's a precursor to Digipulse work, but with help of Five Rights, who are partnering this, we built an app which allows us to get almost real-time data about exactly what children are doing in terms of what apps they're using. And we can't see what they're doing inside those apps, but we do know when they're using them, and we do know how long they're using them for, and we also can intervene. So we can say, we can set the app to say, if someone's been on TikTok for 30 minutes, ask them a question, do an intervention, which is really important for trying to work out what the impact of individual app use or behaviour actually is. So this app's been produced and we've been piloting it. We get this kind of data, so you can see what children are doing. It could be an adult, well, in this case, it's a child. And what apps they're on. So this purple one is TikTok, you might not be able to see. That's actually just them opening and unlocking their phone, bring one there. You can see all the different things they're doing. They've been doing a bit of Q&A, but that's nice, isn't it? There's shared learning going on there. Not much in comparison to some of these other ones. And you can see that they're doing it into the night as well. And you can see that this is the school name actually here, so probably don't use it at school. So the idea here is, yes, to be able to, the original question we asked of this piece of work was, does consuming very short form, mainly brain rot content for hours at a time have any effect on mood or cognitive function? So we wanted to be able to say, set the app to say, what have you done? When we want to do it, when we did some tests when the people haven't had their phone on, and then we do some tests when they're doing other things on their phone, and then we do some tests when they've been scrolling for quite a long period of time. So I can't tell you the results of that because there's two reasons. One, it's only first children. So even if I could, that it would have to be such a massive impact for us to be able to show a statistically significant difference or effect. The other thing is that we haven't actually presented it to the clients yet, which, and because Five Rights is part of that, and obviously working with LSE and Sonia and Kim, I don't want to spoil that debrief. What I will say is that we've also got lots of film of the kids talking about what they're doing. We've got all of this data, and quite a few of them have donated their TikTok, have done a TikTok donation as well. So they've actually given us their data for 2 years of everything they've been doing on TikTok. And from that, we'll be able to do things like work out how many ads they've been exposed to, what their scroll rate is, or how that's changed over time, how much money TikTok has made from their consumption over that 2-year period. We'll be able to estimate it. We won't know exactly, but we'll be able to do some estimations. I can tell you that early that's quite horrible. And one of the things we want to think about really is what are children getting from an individual app, the time they spend on it, and what's the company getting from that? What is that value exchange? We chose TikTok to focus on because the usage on TikTok is quite uniform. People are scrolling. If you want to go on Instagram, for example, we won't have that visibility. There'll be reels, they might be scrolling, they also might be messaging their friends, they also might be looking at other things on Instagram. So TikTok is it's quite a monotonous experience. So that's why we focus on that. Now we're going to be using this app. It's great we've piloted it. We had lots of challenges, lots of difficulties that we've worked out. We're going to be using this on the work, on Digipoli's work that Sonia and Kim are leading. And that's the work that's going to be happening in the UK, a much bigger sample of children. We haven't worked out exactly what we're going to do yet, so feel free to make suggestions. And it's also going to be quite a large sample in Brazil and Kenya. That's it. Any questions? Just ask away.
Question, but I know our audience is very keen from what we saw in the morning, so maybe I'll see whether they can go themselves now. Yeah, then they don't need it will be Franco and then you, and then we'll move around the room.
Mine's a cheeky question. I want to know what was horrible. You just said something. I can tell you it was quite horrible. I'd like to know what was horrible. But I also would be really, in a more serious way, would like to understand. I was really interested that it's a day and night. So I'm actually interested whether you also look at day and night and whether you actually immediately see different kinds of usage at day and night.
Well, we've got some examples.
Should we take just
Oh, sorry.
and then you can reply to Frank, please.
Yes. Hi. Yeah. My question is about the measure that you developed, right? Which sounds really interesting. I was just wondering if you could tell a little bit more about the kind of the social element within that measure. Because to me, it feels like the primary, factors that seem to potentially correlate with negative reactions are all quite individualistic, right? So risky content, risky interaction, social comparisons from an individualistic sort of perspective. So I was just curious to understand whether there are any elements within any of those dimensions that speak more closely to the social context, but also in ways that go beyond just the digital, right? So as in because all of those, of course, are classified as digital activities, but I'm just wondering, whether some of those reactions will potentially obviously correlate with things that have to do with, engagement in the offline world with, in certain social contexts, right? Yeah.
Let's take one more.
Yeah, also interested in methodology. I think these things are really difficult to measure and quantify well-being impacts, particularly long-term impacts. So any kind of insights that you've got at the other end of doing this research project would be really helpful.
Do you want to go first?
Yeah, sorry. Questions was first one was about what was
horrible.
Yeah. Well, I mean, I asked him to do a very quick calculation based on one child and a quick scan of his recent TikTok usage, and therefore there are quite a lot of limitations to data nation, but thankfully the ads are always there. You can always see those. And on looking around online at kind of the range of values, it was something like, if he's using it an average of 3.5 hours a day, which he is, that's about the minimum that we could find would be £550 a year to TikTok in ad revenue at the minimum, and the upper range is a lot more than that. I don't know how they're going to get that off him, frankly, because he doesn't spend that much money. He's only a child. But that was the thing that I think we're going to look into that a lot more, and we can do that, thankfully. The other question was around.
I was just really interested from both of you, just what you're finding.
I mean, you just looking at the profiles from those 30 children, it's quite shocking how many children are looking at 1 and 2 in the morning. and they talk about, when you talk to them, well, the good thing about that, the method we've used there is we have their data and we spent time with them and talked to them about how they feel, and they've expressed what they do, and they've talked through it, and we can get them to talk through it, and we can see elements of it. They also screen record for us, and they show us the sorts of things that they look at as well. I think it's going to be I think when we put it all together and say, this is what a child is doing on TikTok over a period of a week, in a day, this is what they're seeing, this is what TikTok makes from them, what they're advertised, what it looks like over a 2-year period. I think it's going to be quite shocking to a lot of people. I don't think people really have an awareness of what that looks like. I think people tend to think of their own social media use, and probably everyone here uses some form of social media. I mean, I'm quite limited, but I still occasionally look at LinkedIn. And I think it's very hard to imagine what a 14-year-old, 13-year-old child actually does and sees.
So as a reminder, the social element of this measure, when anything beyond the digital, and then the long-term impact on well-being, were the other 2 questions that.
I'm going to first answer the question on day and night. So we don't specifically ask about when do you do things, but we're asking about impact. And I think the most strongly impacted area, and that keeps coming out in our survey, but also in stations of qualitative research we've had across but I think that's a really actually good question. If we administer the same measure during the day and at night, although this asks children to report on the past 2 weeks, and maybe something better suited to the digipulse when you have that momentary kind of assessment. Although interestingly, one of my students have just done a project about social comparisons and mood in the morning and at night, and how it's related to sleep. So when we analyze the data,
Very interested.
and this was a diary study asking in the morning and in the evening. And now the question on social interaction. So I agree, social work is really important, and we do have a factor, social engagement. So social engagement includes chatting to others, sharing posts, liking posts, and so it's very social aspect of digital activity. We also, some aspects of social engagement are included in risky interactions. So being treated in a hurtful way, being excluded from something that others are doing online, and also I'm just trying to remind myself and meeting people first met online and in person. So this all incorporates different social aspects. In addition, we have also managed what happens socially offline. So the availability of friends and social support and community. But as I said, we still and the final question was on
The
well-being.
long term, I think it would the focus was on the
Methodology. Yeah, just methodology really.
Methodology. So we measured symptoms of depression, anxiety, and we also asked questions about well-being. But again, we haven't been able to analyze it yet over the course of 18 months. And I believe all these questionnaires measured the scale of the past 2 weeks, so we can sort of see how these relationships unfold over the course of. It's not a very long time. We're hoping maybe to ask for consent to be able to follow up adolescents for longer, but again, it's also subject to resource. But there's some, I think, we have a good foundation.
We very quickly run out.
Just a
of
couple
time.
things.
I'll give a final word to the speakers. There's going to be coffee at the end, and we have a next session without a break, so I don't want to take time from this one. So I'm just going to give the speakers a final word of summary, and invite you to come and talk to them during the coffee break at the end of the day.
I'll just say a methodology. So for the study we just did, the small pilot, we've got wellbeing measures which we're using, but we're trying to minimise those. That's obviously because we're interrupting their behaviour and then sending them back to it, if you like. We don't want to make it into a big research exercise. There's been lots of time on that, and then we're using Stroop test in this instance for around some aspect of functional attention. I just also want to say on the day and night thing, we did a piece of work in the last year, again, happens to be a Five Rights in Mexico, where we talked to young people around a range of subjects, and some of the stuff was around depressive content. And it was really interesting that the children reported, and their avatars also showed differences in particularly depressive content, depending on whether people were looking at it in the day or the evening. And I suspect that is, I don't know why that is, but my guess would be that it's actually taking cues from the people around you. There's some localized element in the way that your profile by TikTok, and that has some impact on the algorithm. So it may be that people are seeking out content of a different nature, and then that's impacting what the other people in your locality also see. But there are differences between what we see in the day and in night, and not necessarily positive.
My final word, I think my final word is my ambition for the Orchid project is really to move away from thinking, because it's narrow thinking about strength of resilience, how we can, not just within the child themselves, resources that we had about earlier, maybe struggling to navigate as well. Actually how we can, because children already have some very resourceful, very resilient, but how we can support them. Thank you very much.
Tony, thank you.